it seems like I've been in practice for forever, over 35 years, I think. I lost track, and we decided to put together some really some fascinating stories. And John, you are certainly an amazing guy, and you have a lot of stories to tell. So you taught me a lot, and I'm sure you're going to teach everybody else tonight. So um, of the thousands of patients that I got to see, you certainly are quite inspiring to me and to other people. So I look forward to our little discussion today. Um, Next slide, please. So I'm not sure if Katie or Yasmin wants to say anything right now, or we should just let John introduce himself.
Yeah, just go right into an introduction is perfect.
Okay, John, why don't you tell us who the hell you are?
Well, that's a picture of me when I was in my 30s at my very first job at the Foothills Hospital at the University of Calgary. I want you to know that I have lots of gray hair, and I had gray hair when I was 18. It doesn't mean I'm worrying, but you can see me playing with this little baby. The interesting thing about my stethoscope, if you're looking at it, guys, it's long. It's very long. And it's very long because I had to go inside incubators to get to the baby to listen to them. And so it had to be long enough to stretch into an incubator.
So John Deacon carries two perspectives. He comes as a physician, as a neonatologist who specializes in the treatment of very young and premature babies, and also comes to us as a patient perspective as well. So we're going to learn more about that. And next slide, please. So tell us a little bit about yourself there, John.
Okay, well, I'd like to sort of start by saying both my mother and father were immigrants, one from England, my dad, and one from Jamaica. Neither one of them went to school past the age of 12. In fact, my mother never went to school. And so education was a huge thing in our lives, and they certainly encouraged their three boys to study and to do well. I started out going to university when I was 18, didn't do well, failed twice, got hoofed out of the University of Toronto with no capacity to return. I then worked for 4 years as an assistant something or other in the Guarantee Trust Company in Toronto on Bay Street. Learned quite a bit about money. And at the end of that, appealed to the university to let me back in, now being in my mid-20s, let me back into school. And they decided to let me back in. The day before I went back, I met my wife, who was a school teacher, fell in love with her, but she had rules of engagement, and they were that her homework had to be done and my homework had to be done, or else we couldn't even talk on the phone. What happened? End of my first year back, I got 1A, a bunch of B's, and an A average. My A was so high that it dragged all the B's into the A's. My next year, I got straight A's and came first in my class out of 500 students in that particular course. Applied to 2 medical schools, got into both of them. And that's with a failed in university twice, a really a bum, and then my life changed.
You know, you sound like the Grey Cup yesterday. The Toronto or not
Montreal.
Montreal, Montreal. I grew up in Montreal, and they weren't expected to do very well, and they went on a winning streak and beat Winnipeg. Sounds like you did the same thing too about your career there.
Yes.
What turned it around? What made you
Well, love turned it around. And if I wanted any attention whatsoever, and so she taught me basically to study. And as soon as I started studying, great things started to happen. So anyway, went off to Well, maybe need to add one more thing. The one more thing is that in 1958, when I started university, you had to do something athletic. So I decided the cheapest thing I could do was to buy a bathing suit and to swim with this on the swimming team. So I joined the swimming team, and that required a significant amount of discipline, as well as a lot of hard work. And by the end of that year, I had had a world record for 200 meters. I had won 2 gold medals in the university championships, and the University of Toronto won the university championships that year as a result of me and the other fellows on the team working so hard. So that was something that happened to me that caused me to have the capacity to have a discipline. At one point in that year, I was swimming 10 miles a day. Now, I don't know that you have any idea how long it takes to swim a mile, let alone walk a mile or run a mile, but swimming 10 miles a day is a lot. And anyway, so that's just that.
So one of the things where I'm going to pause here and say this: to be good at something, you have to work hard at it.
Very hard.
There's this rule of 10,000 hours before you become good at something. I'm not sure the exact number, but what I find right now is if you want to be healthy or you want to learn something, you got to work at it. And I don't understand why more people aren't investing those hours of hard work in their health to learn more. I know as myself as a physician, yourself as a physician, we love learning, and lifelong learning is certainly something that's endeared to all our hearts. And we're trying to get the average person out there to become a lifelong learner and learn about their heart, because you're going to forget 80% of what's said at the doctor's office. There's no way in our current healthcare model that you're going to get everything you need to be healthy. We can give you directions and guidance, but so I think rule number one for many people is hard work. And most times when we do something, we're not going to be too successful the first time along the way. We get better at that, and you certainly have been very successful in multiple ways. So keep telling us more that we should learn.
Well, I with my swimming skills, I wound up teaching people how to swim. And most of the people I was teaching how to swim were very young. And so I gravitated towards children as my chosen care model. So I went into a pediatric residency. At Christmas time in my first year of residency, I was in the nursery and I was by myself. The attendings all went home. And within 10 minutes from being healthy to being not healthy, in fact, being dead, 3 babies dropped dead. 3 out of 20. And that was the event that said, I got to do something to stop this. So that led me into neonatology as my field. I'd like to say that it's a wonderful specialty because you have to learn how to communicate with somebody who can't talk. And the result of that is you have to learn how to listen. And you have to hear what the baby is trying to tell you when they can't use words. And that's a skill that everyone in Dr. Curnew's office needs as well. I have a prejudice, and the prejudice is I can't turn to the baby and say, baby, where does it hurt? I can't ask them that. But I can listen to a baby cry and tell that they're hurting, or that they're hungry, or that their diapers are wet, or something. I can do that. So that requires
So John, I think one of the things is that we as physicians need to gather information and synthesize and put
Yeah.
a picture together.
Yeah.
You as an individual, as a patient, you need to help organize that and help put your thoughts down and to prepare for that. So one of the things that we start right now is something called ocean forms.
Yes.
So we email you a form
Mhm.
that has some questions that we want people to answer. And right now, less than a third of people are responding to that. And I'm sure that's going to change as time goes on there. Um, so John, we sent you some Ocean forms. I looked at your Ocean form today. So Ocean again is a software company that allows us as if we have your email address to send you a form, and we have a webinar on that. And maybe Amir can show us that webinar. I just pop that on there if you can, just show it. We can find that as we're talking right now. And I'm encouraging everybody to become an active member of their healthcare team. And one way is to, what are the questions you have, and to fill that out and send it back to us. So, John, when you look at the Ocean form, what do you think?
Well, I think it helps me because it helps me to focus on things that I want to leave for you. So I like it. I don't have any complaints about it.
So we try to
Not
keep it
sure.
we try to keep it simple. We have this form that says, so we said there's multiple oceans in the world, and this is the new wonder. Ocean is the name of the software company that gives you information. So fill it out, complete it, send it to us, and ponder. Good. So tell us how you became a patient.
Well, when I was in my second year of medical school, on my brother's 21st birthday, my baby brother's 21st birthday, my mother died suddenly. She was 5'6", 110 pounds, and skinny as a rail. In her young 50s. We didn't know what happened, but suspicions, of course. The fast forward, I'm in my mid-40s, and I'm running to a delivery of twins at another hospital. I got a tickle in my chest, didn't know what it was, stopped for a second or two, it went away, went about my business. Saw one of my partners in the hospital the next day, and he said, "You better come in and we better take a look at you." And sure enough, by the time I got to the angiogram, they told me that I had 50-50 chance I was dead in 6 weeks. I had 90% or 95% occlusion in the 3 major vessels supplying the heart. I was 46.
Here's a couple messages over here. So we can all be a detective. So to me, angina or heart pain, when you exert yourself, you have some form of discomfort. It's not a pain doctor, it's a heaviness, it's a weight. Anything that's exertionally related, you have to think about the heart as a possibility. The other thing you have to be smart about this is we're talking about genes right now. The cheapest way of knowing your genes is to knowing your family history. And your mom had dropped dead at the age of, how old was she again?
52.
52. So usually women have heart disease 10 years later than men. And so one of the big red flags in my mind is that if you have a first degree relative, so it means a brother and sister, or your parents have a heart condition under the age of 55 for male or female, that doubles the risk of you having a heart condition. And you can see that. And I look back at some of my stories is that your parents come from immigrant backgrounds, mine came from immigrant backgrounds, and they put so much into our education and really guided us to become, educated. So one of the things is I want to guide everybody to be educated in their health and to pick a career that they can love and cherish and learn about this. And that happens to less than 25% of us. So I think you and I, John, are lucky that we found something that we love and that we can get better at and keep crafting our skills. So message to everybody out there is that know your family history, know who has cancer, what age. If you have heart disease, at what age did it first start? My dad, for instance, I was in um, doing my residency at one of the Yale hospitals, and he had a bypass at the age of 50. And so it made me decide to look at my health better. I had this hygiene called high LP little a, and I'm on cholesterol medications, and it's not enough. Even 2 cholesterol pills is not enough in addition to lifestyle changes. My 20-year-old son also inherited this condition called a high LP little a. And maybe we can actually show the little video about that too, Amir, as we go along there, is that 20 to 30% of us in Canada have this gene. It's a cholesterol particle that increases your risk of a heart attack or stroke by a factor of 2 to 4. So if you're positive, and here's the video we have on this, just take a look at it. So everybody should have this measured once. Everybody should do a proper family history of themselves. And if you have exertional symptoms, need to be looked into, especially if they're changing in some way. Now, the difference between what year would you had your bypass? What year was that?
Valentine's Day, 1986.
So back in 1986, the surgeon would always say to you, I got to you just in time. I saved your life. If you waited weeks later, you would have died, because we didn't know that back then. Yeah. We now know that if you have blocked arteries, that the best therapy right now is treating some of the foundational therapies of lowering your cholesterol, lowering your blood pressure, keeping your weight, not smoking, proper weight. And I think you told me back then your weight was a little bit of a problem. And
220. I was 220 pounds.
And how tall were you?
6 foot.
6 foot. And so we use something called body mass index. And I've been a little bit chubby part of my life, or a good part of my life. I'm working at getting skinnier, and I'm still working at it. And my body mass index as of this morning is 21.2. So I'm still slightly overweight. I'm going to work harder to get my body mass index down a few more points. And I'm also looking at my body composition, looking at my muscle mass, because as we get older, we lose muscle mass, and we'll come back to that in a little while. So I think people need to become proactive about this. And I'm seeing so many people just ignoring the writing on the wall. Unfortunately, heart disease is very common, kills, 20 to over 50,000 people in Canada every year. It's the second leading cause of deaths in our society in Canada. It used to be number one, but because of better prevention, it's become number two. Cancer is the number one disease killer in Canada. And I think this business about really delving into your health and your family history is so important. And the time to go for a bypass operation is you have to have blocked in all major arteries, I think called the left main. But if you have blockage of 1 or 2 vessels and your symptoms are stable, the bypass surgery or angioplasty doesn't make you live longer. And many people have trouble understanding that. Is that there's a trial called ischemia, one's called courage, there's even the third trial, because the trials way back when, the 3 big trials showed that if you had blocked of all your arteries, you lived longer with medical therapy, with surgery compared to medical therapy. Now the trials show the exact opposite. For most people with blocked arteries, you live longer with medicines, and doing an angioplasty actually hurts the arteries, it damages and causes heart attacks. So figuring that out, that's my job to do. So don't be afraid. I have blocked arteries, but I'm not going for a bypass at this stage in life. So I have blockage of some arteries, and I'm working at it through lifestyle changes. Well, the best time to have an operation on your heart is when you're having a heart attack, or the vessel is unstable, or your symptoms can't be controlled. So that's changing. That's changing. So and did the surgeons say how much time you had after the operation?
Well, they said there was a 50-50 chance with what they saw that I would be dead within 6 weeks. That was their guess.
Yeah, and I think there's a lot of guesswork involved in this, and I think we've overvalued surgery, undervalued lifestyle changes and medication. But tell us more. What happened next?
Well, they told me also at that time that I needed to lose some weight, and I have. And just to let you know, I can't tell you what my index is, but I weigh now this morning 156.1 pounds, and that's not 220. And when I had the surgery, the cardiologist told me he wanted me to weigh 155 pounds. So I'm within a pound of where they told me it was good for me to be. And along with the encouragement of people like Dr. Curnew and my previous doctors, both of whom, by the way, are now dead. My cardiologist and my surgeon are both gone, but I just want you to know that I listened and have found that the discipline necessary to lose weight is something that did not require medication for me. Because of my ability to do what I did when I swam, is what I believe, I was able to focus enough to exercise just enough and to eat just well enough that my weight has come down nicely. So, and I could lose more weight. I could sure lose more weight. I've got lots of spare fat floating around.
Well, you've done a great job. Next slide, please. What else we have here? Now, medications, and so one of the foundational things is medications. In the past, we used medications to treat illness. Now we use medications to prevent illness. And John, tell us about some of the medications and how you keep track of things.
Well,
I know baskets coming out. Tell us more.
This is my basket, and this is my basket. I keep all of my medicines in there. And when I come to see Dr. Curnew, I bring my basket. There are some medicines that I use rarely, like nitroglycerin, and then there are some that I use all the time, and one of them is Crestor, and I was put on that by Dr. Curnew, and I've been on that now for, I can't tell you how many years, Greg. I've been on it for quite a while. But in addition to that, he discovered that I was hypertensive, and so I'm on medicine to control my blood pressure as well. And to tell you the truth, I don't, even when my blood pressure is like where I couldn't believe it would be, I don't feel badly. And I think that's also made a huge difference, keeping my blood pressure under control by monitoring it all the time and using the medicines that he's prescribed for me to keep it in a nice space. Now, the only other thing I'd tell you is, every once in a while, I've called the office or called Dr. Curnew just to let him know that I wasn't happy with my condition, and I can tell, for reasons that I'm not sure, I can tell when my blood pressure is out of whack. If it's going up and my heart rate's going up, and I can tell that I'm not right. And he's been able to help me dial my medication so that almost all the time now I'm in a comfortable zone for my blood pressure. I don't think a lot of people can feel their blood pressure going up, but I can feel mine.
So studies have shown that most people can't tell if their blood pressure is too high,
Yep.
but most people can tell if their blood pressure is too low, those dizzy spells and things.
Yes.
Blood pressure will fluctuate. And I think it's really important that everybody should have a toothbrush, running shoes, clean underwear, and a blood pressure machine as part of their repertoire of things. And I would make sure that most of us have one of those things. If can't get it, we have loaners that we can provide. But I think it's kind of interesting. You mentioned you had a career in finances at some point in time, and you don't judge the stock market by just one day. It's by the ups and downs, and blood pressure does go up and down. So,
Yes.
Amir, why don't you just put blood pressure and and show that all the different videos we have. In the DASH diet, blood pressure. We have a whole bunch of different videos on that, but please take a look at some. Some are very short, some are a bit longer, but ideal blood pressure is somewhere between 110 to 120 systolic range. And having a blood pressure less than 100, if you haven't have damage to your heart, it's actually a good thing, provided you're not too dizzy and things of that nature. As we get older, our blood pressure fluctuates, we get more dizzy, and we are less aggressive in blood pressure monitoring. At the American Heart Association meeting, there was an elegant trial showing that a blood pressure of 120 systolic was better than 130. We're working at that, and we learned from other studies that 110/70 is the ideal blood pressure. It may not be a target of therapy, but something to think about. So measure your blood pressure. Let's show the next slide. The things before I forget is that cost of therapy. If you just backtrack, mention a pill called Crestor. Crestor costs less than $250 a year to be on, plus markup costs and dispensing fees. You're also taking a pill called, I think it's Praliant you're taking. Is that right?
Yes, I am. I paid for that. That's $412 a month or every 4 weeks.
So that one's not covered for you. The retail price is $7,000 a year, but if people who pay for it can get it for $3,500 a year, and but that's a medication that lowers your cholesterol even further. So the two biggest medications are Crestor, Lipitor, and adding 10 milligrams of ezetimibe. That will lower your risk of heart disease by about 60% in many cases. Now, in your case, because you had quite a bit of blockage formation, we decided to go the next step, and those are injectable ones. Then the two biggest ones are Praliant and Repatha. There's a one that every 6 months right now called Eliscarin that's just came out. Sorry, inclisiran, excuse me. And so there's all these new therapies are developing. We can decide if you need the old ones and new ones and combinations of both that. But don't be afraid to discuss cost of therapy, because John, you're lucky you can afford the medication. Other people can't afford the medications. And the worst thing is to say you can do something that you can't. So tell me what to do. I'm a penny pincher, and I will try to find the most cost-effective way to keep you healthy for as long as you can. But don't be afraid to discuss that. Next slide, please. What do you want to say about that there, John?
Well, I've been in your office when people have been fuming about how long it takes to see you. And my statement is, I don't think that you've ever shortchanged me with the time that we have spent together to find out what was wrong with me and what was the best thing to do next. I don't think there's ever been a time when you've done that. I know many, many physicians who have the 5-minute rule. When you come in the office to see me, if I can't figure out what to do and how to take care of you, I shoot you out the office in 5 minutes, no matter what. You've never done that. So my message to the patients is be patient. That's your job. Be patient, listen to yourself, listen to your doctor, tell him what's happening to you so that he can help you take better care of yourself. And don't worry about the lineup. Don't worry about how late you're going to be. He's going to be late too, by the way. But that's be prepared to be patient. Be prepared to be a patient. Don't be prepared to go in there and yell and scream and be upset. And that, as far as I'm concerned, is why our relationship has worked so well. That I'm patient with you, you're patient with me, and both of us are trying to share the information that we have with the other to the benefit of us both. So that's my message to the patients. I have a message to the medical students or to the residents. And my message to the residents are, I want you to think, looking me straight in the eye and wanting me to tell you what's happening to me, what's the question you have to ask? And the answer to that question is, how are you? And then shut up. Because you need to hear what's on my mind. It may not have anything to do with cardiology. It may not have anything to do with my heart, but it has everything to do with what's on my mind and what's bothering me. And until you can break through that, you're not going to win me over as a patient and establish yourself as the caregiver, because you're asking me to share with you what's bothering me. So the very first question I would like you to turn to me and say, look me straight in the eye, put your hand on my shoulder and say, how are you? You can get around to the, how's your ankle swelling and do you having any of this or that? You can get around to that in a second or two, but put that one in first, because that one is the way Dr. Curnew establishes his care of me. That's how he starts it. How are you? He doesn't ask me about all the other stuff. So I would encourage you to watch your mentor, because he's a very, very special person, and his ability to do this in a fraction of a second, it happens so fast you don't even know it's happened. So that's my suggestion to you. When I was referred to him by my doctor here in Simcoe, he knew something about Dr. Curnew that was going to work for me. And he knew me and he knew Dr. Curnew. In fact, it was his nurse who is the one who said, I want you to go to see Dr. Curnew. And she knew all she needed to know to have me come there. I have never had a physician like him, never. And Greg, I look at you and I'm wishing I was young again and could be working beside you. I think you're just an amazing character, and you've taken very good care of me. I don't believe that at 84 I should be still running around with the disease that I had when I started, and a large part of that is due to the caring that you've given me, and the courage. Keep walking, you said. Do something. Well, I can't skydive, but I can play the ukulele, and I've started to play the ukulele. He's flying planes. I'm playing the ukulele. I'm picking up something new, 84, and I'm going to learn how to do this. And I'm not bad.
Well, you're a great singer, and you make everybody around you better.
Yeah.
It's kind of interesting how one learns to practice medicine, and one of the things is I'm blessed with a series of so many students working with me,
Mhm.
and they fill in a lot of the blanks. And I'm thinking yesterday was the 2023 grade.
He's talking Grey Cup.
I think we're just having some technical difficulty. Here I'll.
The beauty of technology. We have so what was the last thing what I said? You hear about the medication part?
Yep.
No, okay. So basically, is bring all your pills all the time, all the pill balls. My students are going to really go over that with you. Be prepared. What are the things that are important? Everybody should have a notepad when they come in, and fill out an ocean form before they come down, and don't be afraid to write that down. Now, the way my brain will process is at times I want people to be quiet, let me process information. Other times, add to that. And because I have to take all this information very quickly and decide a plan of action for you. And I really want to stay focused on you at that moment in time. And I think it's important for you to stay focused too, and to work together, because some decisions are very easy, some decisions are harder. And I need to understand about that. Who should have a bypass or an angioplasty? If we just looked at blocked arteries, if you make it to 60 years of age, 90% of us have blocked arteries, and we don't bypass everybody at the age of 60 years of age because you have blocked arteries. we have to be smart about who requires procedures. And the mistake is, I think we done too many operations and angioplasties and not enough of good medications fix the foundation. So that's great. So and some days, you're full of energy, you can change the world. Other days you're just tired. We have our good days and bad days, but bring energy, and you bring energy to around us as well. Thank you. Next slide, please. Yeah, so I want people to just, really come prepared. Why am I? Well, answers like, you should know this. I told you that last time is not a very helpful statement. And you might want to say, well, the chest pain that I've been getting before my bypass operation or after my angioplasty went away, came back again. Always add perspective and always be encouraging. And really try to get better. And you mentioned about you're playing the ukulele. I'm going to fly a plane glider. And I just got back from a holiday with my wife and went to this exercise retreat, this movement. I had time to exercise for 4 hours most days, good, healthy food. We were in bed by 8, 9 o'clock in the morning, up by 5 in the morning. And really it was remarkable vacation and felt charged. So at one time, I used to like to go to all-inclusives in Mexico. I don't want to do that because I just too much food to eat and too much to drink, and I want to be healthy. And at this stage in life, I realize that my body is aging, and so I need to take better care of it. And you've done a great job about that, John, about doing that, and learning new things. Well, we learned the Apple, or you taught me about computers and about electric cars, and I'm learning how to fly a plane glider now. I'm up to 186 flights. Still not ready to fly solo, and that's okay. But I'm getting better at it. And if it takes me, I don't know, some people will take 60 flights, some people will take longer. I know I'm going to get there, and I'm enjoying the process, and wonderful people teaching me. So if you want to lose weight, it might take you 200 times. You want to stop smoking, it might take you 200 times. But I'm curious, you're curious. Be curious about your health and learn about it. Don't expect someone to just spoon feed you. If you want, that's the easy part to do that. But learn and get better and keep practicing anything that you do. Anything you want to add to that at all, John?
Well, yeah, this is not with regards to the heart, but I also have osteoarthritis of both hips, and I have some curly little fingers. I've chosen not to have my hip replaced. Reason? I can still walk. I go to the hospital every day. I park on a street a ways away from the hospital. I walk to the hospital. I can do this. And the more I walk, the less pain I have. So I'm trying to not need a hip replacement. And as long as I can do the things that I want to do and stay relatively strong and healthy, I don't think I need a new hip. I don't know what Greg thinks, but I don't think I do. I think I'm okay.
To me is that staying functional is really important. And one of the things that exercise hurts your joints, but actually doing exercise properly actually strengthens the ligaments, strengthens the bones, and improves pain. So, if you're having pain from arthritis, exercise done appropriately is a benefit to pain management. And I agree with you totally about that. It's that there's a time and place for everything.
Yep.
And what we want to do is maximize your quality of life and take the right risk at the right time. So having hip surgery when they're in your 80s is always has risk, and you have to really feel quite severe limitations about that, and try other things first. Exercise, injections into joints as necessary, proper footwear, physiotherapy. I'm now going for physiotherapy twice a week. Is that because there's dementia in my family? You can maybe talk about, maybe I'm demented already. Some days I feel that way. for sure. And falls are a big problem in my family, and my sense of balance is nowhere, and it's good. So I go to an active physio department 2 times a week between 6 a.m. and 7 a.m. on Mondays and Wednesdays. We're a group of people, and it's one of the most important things I've done for my health recently, and building my muscle mass, because I realized that the average person will lose between ages 30 and 70 half their muscle mass if you're not careful. And the only way to do that is by weights, resistance, push-ups, sit-ups, weights, bands, etc. And most people don't do that. Only 25% of people do reasonable amount of exercise. 25%, and it's if you look at some of the longevity studies, exercise, activity, and weight are very important factors in all this. Absolutely. Tell us about that valve of yours.
Well,
So-
I was noticing that the capacity for me to walk for a length of time was decreasing, and I talked with Dr. Curnew about it, and at one point or another, with the diagnosis that I had, which was aortic stenosis in addition to my heart stuff, Dr. Curnew suggested that I consider replacing the valve, and I said, I think I'm ready. So went in, and I was awake during the procedure, and again, like my blood pressure, I can feel it. At an instant, I said, "Whoa, what happened?" The guy said, "We just dropped the valve in. It just popped in." I said, "I knew right away that something good had just happened." And my cardiac output must have changed, Greg? My heart was working not quite so hard, and I knew it. I could tell. I could feel it. And ever since then, I've been able to walk without concern. I don't ride a bike, but I swim, and I think that was a big change for me to have a valve dropped into my aortic valve area, and instantly knew that it was better. And that was another wonderful change in my care. Wonderful change.
By the way, John, your body mass index is 21, by the way. So
same as yours? Oh my gosh.
No. Mine is 25 and a half, 25.1 or something. So ideal is between 20 to 25, and I'm also looking at body composition, and we're actually going to have we're doing this. What people are using Ozempic on right now is that you can lose both muscle mass and fat mass. In fact, as we get older, we tend to replace our muscle with fat mass, and so we have to work hard at that. So and that's important. And going back to what do you got there?
Weights.
Good. And maybe Amir, you can show some of the videos we have on exercise as we go here. But one important thing to me is that exercise is a foundational therapy. So one of the things is that is that we keep showing some of those videos. We have some stretching ones. Keep going down the list there. We got lots of them here. We have chair exercises, we have short ones, and for congestive heart failure, it's important. And this relaxation, meditation are so vitally important. One of the leading things of preventing Alzheimer's disease is doing those 10,000 steps a day. So I think of exercise in 3 phases. One of those aerobic activity, like the swimming that you talked about. And by the way, swimming when you're young doesn't mean you're going to be healthy later in life, but it also we know that if you exercise young in life, you'll probably exercise later in life, and you'll go back to that. So it's interesting. And you were a swimmer at one time, and you're still swimming at this point in time. I'm grateful to my parents. Is my mom loved tennis, and she made me play tennis, and I played tennis and squash today after not playing for 10, 20 years along the way. So really important, and to feel how that's going to put in now. I have my Fitbit over here. I'm averaging about 12,500 steps a day at this point in time, and so encouraging people to get to the 10,000 steps per day, and maybe you can show us our YouTube video about step counters there too as well, and if we go to our website, we can actually register. You can actually look at my steps or your steps, and there's different things about this over here. So well, we go back to the slides there. We can find that a little bit. There we go. These wearable devices that we have, and I think they're kind of fun. And I need a wearable device that stops me from eating sometimes, but that's a different story. I wish that I haven't found that one yet. But just sort of think about how that fits into now. About your heart valve, that's a very interesting discussion. Your valve had worn out for quite a few years, and the question is timing of surgery. And you were doing the things that you want to. Just because the valve's worn out for aortic stenosis is that the time for surgery is when you have a severe pressure difference across the valve, usually 40 to 50 millimeters of difference across that valve, and you're having symptoms. You can't do what you want to when you're walking, you're exerting yourself, you get the shortness of breath, heaviness, or you may be passing out. And in your case there, you had a very severe valve narrowing, and we decided to wait a number of years because you were tolerating it quite well, because there is a risk of dropping in a valve is not such an easy thing. It's down now for, as we get older, called TAVI, transaortic valve implantation, where you can put them in on a balloon. Sometimes you need surgery depending on circumstances. So there's a couple ways of doing that now, and timing is crucial. And that's why we use the echo or physical examination, how you're doing to make that. If you go back to our presentation, that would be good. So I think timing is always very important. What's the next slide? Now, vaccines has become a very polarized area. And if you go back to some of the webinars, just put vaccines in there, and maybe you can show people how you decide. So you're going to that little hourglass there, and you're going to put vaccines in there. And I think, is that there's complications. There's one about, vaccines, just getting the flu shot, for instance, decreases chance of having a heart attack. The power of vaccines is really quite an impressive vaccine. You talk about the history of vaccines in general. And so to me is that I had my Shingrix, my pneumococcal vaccine. I'm thinking of getting the RSV vaccine this year. I get my yearly flu shot. Right now I'm getting a COVID vaccine every 6 months. And it's the best way to treat illness is to prevent from happening. And so you can talk about your doctors about what vaccines are most important, or your pharmacists. Some will be covered, some will not be, but it's a great insurance policy. And as we get older, our immune system starts to fail. So immune system in your 20s is a great immune system. 50 or greater, your immune system starts to fail. We learned from COVID, for instance, unfortunately, the number one casualty rate was in people over the age of 70. And so the older you are, the weaker your immune system is. So we need to figure ways to strengthen that. So if you go back to the presentation, and please use these webinars to start off with. What's your thoughts about vaccines?
Mine?
Yeah.
Yeah, as a pediatrician, I'm 100% in favor of people being vaccinated. 100%.
And talk. Yeah,
You
go
take
ahead.
things like you take things like whooping cough and stuff like that, and it's not to say that the vaccines don't cause or can't cause problems. They can, but the incidence of complications from something like the whooping cough vaccination might be something like 1 in 200,000, whereas the implications of some serious thing happening to you with whooping cough is like 1 in 100. So you don't, those two numbers are just not to say that you're the 1 in 200,000 or the 1 in 100, but absolutely the most wonderful things. I remember when I was a child, one child in our school came down with polio every year. And I remember when we, I guess it was 1953, I think, when we got our polio shots, and it was like, wow, what a huge change that was for us all. So no, I think the weaponization or the politicization of medical therapies is so sad, and the damage that's been done to the number of people who've succumbed to COVID as a result of not wanting to be vaccinated or take the right medicines is just so sad and so silly. So yeah, please be vaccinated.
Yeah, so explore that. And COVID has changed, the vaccine has changed, and the world has changed. So you have to decide what to do. Which we don't know is the long-term effect of getting COVID multiple times. John, you just had COVID. Your wife's in the hospital right now with COVID,
Yeah.
and she has Parkinson's disease, and it can affect multiple organ systems. And so being vaccinated doesn't mean you won't get COVID, but you'll have a less severe form of it. And the side effects are relatively minor in comparison to the long-term implications, because it goes through something called the AT receptor, which is a receptor that lines all your blood vessels in your brain and kidneys and your heart and your pancreas. And so what I don't know is getting COVID multiple times, will that lead to like concussions doing it, just multiple insults to organ systems that the body recovers from? Will that lead to problems in the future? We just don't know, but I'm fearful of that possibility. So I think an ounce of prevention is something to be considered. And so, this is flu season, so influenza is something that can be quite deadly. And we all know that getting the flu shot actually decreases the chance of heart damage, because influenza causes inflammation, which damages blood vessels. Now we have the RSV vaccine. We have the pneumococcal vaccine. The whole story about vaccines in general is quite amazing. So just think about how that fits in to your repertoire, and don't be afraid to ask questions. And the information is changing all the time. And I guess in science we're used to that, because what we say today, what we say yesterday are changes, and that's good, because facts change, information changes, and technology changes. Next slide, please. The effects of age on your body. Tell us a little bit about that. Who's going to tell us about that? Is that you, Katie? You could tell us about that?
Yeah, we just have a couple basic stuff that we threw together. Feel free to chime in, either of the doctors that we have with us. But we just picked a couple places that aging we know can impact the body. We started off with the brain. It can lead to decreased effectiveness between neuronal communication, decreased blood flow, shrinkage of various parts of the brain, and then all of this can affect structure and function of the brain, so our memory and learning processes. I don't know if you want to add anything before we move forwards.
I don't know about you, John. My brain is not the same brain I was when I was 20 years of age. It's full now with more information, probably more disorganized, harder to retrieve things, and less able to multitask than it was before. But it has a lot of experience, and but processing speed is dramatically reduced. And I do know my brain has shrunk. And I do know that I have dementing illnesses in the family. And one of the ways to actually protect your brain is to exercise and put more pathways, more neuron pathway, by learning new skills. So you're playing the ukulele. I'm doing my exercise, and I'm learning how to fly in a plane glider. And I think I formed some more neurons yesterday flying that plane again. And I'm very grateful for the opportunity to learn these new things. And I think by being able to work and things of that nature, I'm constantly challenged and learning new things. So what's your thoughts about your brain? How does your brain feel?
I'm the same, and I have an Apple Watch, and if I click it, it pays bills for me. And I learned how to do that when I got my first watch. And I went into let's say McDonald's or some other place, doesn't matter. And I tried to pay the bill with my watch, and the guy didn't have a clue what the heck I was doing, showing in my hand. So the answer is, for whatever little tricks that are fun for the brain to engage in, whatever you choose doesn't matter, but choose something. Choose to fly a plane if you want to fly a plane. Choose to play an instrument. There's nothing quite like learning to play an instrument, I can tell you, or singing. Music is peculiar because it does things for you that other parts of the brain don't get the same kind of exercise as you do when you sing. And the other thing I would say to you is, it's almost impossible to be angry or upset when you're singing. I don't know if you've tried that, but when we all arrive at our rehearsal on Tuesday night at 7 o'clock, and half of us are ticked and the other half don't give a darn, well, by the end of the day, by the end of the night, we're all engaged and enjoying ourselves and relaxed. And so pick something like Dr. Curnew or like me, and just go with it, because it does wonderful, wonderful things for your mind, wonderful things for your brain, and worth every amount of effort, every amount.
And have fun learning. I remember we spent some time at the Apple Computer Store many, many years ago, where they had all these learning sessions, and I spent many, many hours learning and forgetting and learning more. So those were fun times.
We were at one of them, and we were learning, I forget what, but it doesn't matter what we were learning at that point. And I turned to Dr. Curnew and I said, Dr. Curnew, give me your credit card. I want you to get with the program, and I want you to consider getting yourself an electric car. So he pulled out his credit card and we went online right then and there, and I ordered a car for him. And, I have an electric car as well. And it's life-changing. Greg, you can't tell anybody that doesn't have one. It is unbelievable. And is it a hassle to have to charge the car? No, it isn't a hassle. And you know what? When you're charging the car, you're not inhaling fumes, which, by the way, are not good for your brain. Greg?
Yeah,
Diesel fumes, gasoline fumes, it's not good for the brain. I don't think it's probably good for the heart either, but it's high time that this became a treatment, I think.
Yeah, and I can't say anything more that it's the right thing to do. And most of us drive less than 50 kilometers most days, and is that it's been a great joy owning an electric car. And you can pick one you want to. I like the ones that have driving assist to it, so and that keep learning. So my car is a better driver than I am, but we're a good combination. So I feel safest in
that's going to change. That's going to change insurance policies. That's going to change the number of accidents on the highways. It's going to change everything when everyone has one. That's
and the car doesn't drive itself. It's a driving assist at this stage, and it makes it.
But you don't think for a minute that the car isn't going to start talking to the car in front of you and the car behind you at the same time. That's coming too. If it can, that's all going to happen, and accidents are going to be avoided.
So your brain gets older, it's not as good, but still works quite well, and keep it working finely by learning, put new neurons, new thoughts, exercise, avoid illnesses, avoid bumps on your head, avoid infections, look after yourself. Next slide, please.
That's encouraging for me because I'm trying to pick up crocheting and I'm getting really annoyed because it's not natural for me and I like being perfect, but it's good for me. Okay. The next area of the body we're gonna look at is the lungs. We kind of touched on it when we talked about gas. It cannot be good for you to inhale those fumes, but there's various muscular and cardiovascular changes that happen and can affect your lungs. There's weakening that can happen in the diaphragm with aging, thinner rib cage bones, decreased sensitivity of the nerves in the airways, as well as a loss for the shape of your alveoli. So various things happen within your lungs with aging. I don't know if you want to elaborate on the lungs any further.
I think your peak lung function is in your late 20s or early 30s, and lung starts to decay, fall apart, and so people who have this smoking issue, you're not going to have problems usually in your 30s and 40s, but you're having later in life. And then once you lost, a good chunk of lungs, and plus you have, if your lungs can be compressed because of your body size, so that will reduce your lung volumes. It can be reduced by just aging, and smoking accelerates that process there. So I'm afraid that it's going to lead to a problem later in life. So thanks for sharing that. And so keep training your lungs, get out there and exercise, do some aerobic activity, get your weight down, don't smoke. Next slide, please.
Kidneys. There's a decreased amount of kidney tissue with aging, decreased kidney function, a decreased number in the nephrons, and then as well as hardened blood vessels. Don't know if we want to add there.
Yeah, so one of the things is that 25% of your blood supply goes to the kidneys. So it tells us a little bit about the blood supply to the rest of your heart. And you have decreased renal function as time goes on. How many nephrons do we have?
900,000 to 1 million per kidney.
We have about 1 million nephrons per kidney. These are these little filters, and they actually die out as we get older. And so we have ways of preserving kidney function, from lifestyle changes to controlling blood pressure to ACE, ARB therapy, something called SGL2 receptor antagonist. For instance, an SGL2 receptor antagonist decreases the chance of end-stage kidney failure by 30 to 40%. I'll repeat that. SGL2 receptor antagonist would, if you're leaking protein in the urine, especially, they can actually decrease the chance of end-stage renal disease, need for dialysis by 40% up to that. So, and I expect my kidneys to age, and I'm going to protect them for as long as I can. Next slide, please.
And then our last area that we're going to touch upon is the muscles. With aging, there's a reduced number of muscle fibers, smaller muscle fibers. I saw some weights there. Slower replacement of muscle tissues, reduced muscle tone, and then decreased ability to contract. So exercising is very important as we grow up, obviously.
Yeah, so most of us still can walk, and as you lose the ability to walk, so your legs usually stay stronger, and your upper arms and chest starts to feel that first. And again, we lose 50% of our muscle masses between the ages of 30 and 70. That's the average. And the two ways to decrease that, number one is you need to use your muscles against resistance. So you need to push or pull things, from weights to bands, and need to keep working in this direction here. So don't forget that. And the mistake I made is I waited too late in life. When I was in my university days, that I was on the rowing team for a while, and I didn't do the weight training I should have. And right now I'm doing it now, but I'm paying a big price for that, and that's aged me quite a bit, and that's important. And so get out those weights, and
they don't have to be huge. This is 2 pounds. I mean, it doesn't have to be big.
So if you want to train muscle, they have to be a fair amount. You need to be able to do like 6 reps, and then feel exhausted, and do that about 4 times to actually really thicken the heart muscle. So depending what you want to do, and so the smart thing to do is find somebody who knows a lot about training, and that's what I do. I work with people who know a lot about this, and from proper body position, holding things, and and I find doing it in a group of people makes that much of a difference right now. So don't forget to look at that. So VO2 max, how much your horsepower is through aerobic activity. Intensity is important, so you have to push yourself. And the other thing too is those weights or bands. And if you want to just start somewhere, look at those chair exercises that we're doing, or join a program for seniors. Thanks for sharing that. 50% of muscle mass, you can lose that if you're not careful. And once you lose it, it's hard to bring that back. Yes, you can bring some of it back. You can't bring it all back. So this medical term is sarcopenia. Means your muscles are getting weak and replaced with fat. And so I'm going to try to get some of that fat into muscle composition. If I can do it, you should do it too. And I know, John, you're doing that too in your own way too as well. Next slide, please. So, John, you give us some tips on how to age well.
Well, this is us this summer. And I don't know if you can see the love that's in the hands of the person with the pink shirt. I went in to see her today, and she can't stand, can't walk because of the irritation that's happened as a result of the COVID. But she turns to me and says, "You're the best thing that ever happened to me. I love you to death." And you know, it shows in that little picture there that how much caring, what caring is. So just as the doctor and the patient care for each other, it is wonderful when this kind of relationship occurs, and I love her to death as well. And all we're doing is watching the waves.
When I see you, John, I see you and your lovely wife together as a wonderful package. And some of the longevity trials talk about, quality relationships that you have. And now you went through a divorce, and
oh, I can tell you about that in a heartbeat. Got married to a nurse who decided that I was to be her husband, and we got in the car heading out for the honeymoon, and she turned to me and she said, "I've just made a terrible mistake." That was the first words that are out of her mouth after we said "I do." 24 years later, we fixed it. We separated. We are still in touch with each other. We still care about each other. I'm not sure if love is the right word, but we still do love each other. But the best thing for her was to not have me, and the best thing for me was to not have her. And that allowed me to come back to Simcoe and meet and marry my childhood sweetheart. Yeah, so I don't know. So yeah, I think that's all I need to say. When we separated, the attorney that was my attorney and her attorney said, "Dr. Deacon, what do you want?" I said, "Oh, all I want is a divorce." "Mrs. Deacon, what do you want?" She said, "Everything." I looked at her and said, "It's all yours." Gave her the house, the cars, 2 Mercedes, the place down in New Mexico, my pension, which at that point was over $1 million, and gave her the whole thing. And they tell you this is an interesting thing. In The Millionaire Next Door, it's true that the most successful persons are married to school teachers. Evie is thrifty. So in the 7 years that I worked after I was divorced, we saved enough money to put 3 children through university and save enough for ourselves to retire and be comfortable. Imagine, 7 years was all I had. And I'm as happy as can be. I couldn't be luckier. I couldn't be luckier. So I guess that's all I wanted to say. Sorry.
Thanks for sharing that. So, your lovely wife on a stress test in 2020 can do something called 7 METs of activity. That's 1 MET is a unit of work done. 1 MET is your basic metabolic rate. You need about 5 METs to actually function, do your shopping, buy groceries, do housework and things of that nature. And once you get sick, you lose 25% of your cardiac reserve within a couple weeks. Now, that was before her Parkinson's have, added and took away some of that. And so one of the things is to be fit and to exercise to keep that. So right now she's struggling because she was probably doing about 4 METs of activity before she went into the hospital. Now she's probably doing 2 or 3. And so she's not ready to be independent. And whether or not we can get her back to that, we'll see. I'm sure we'll give a good fighting chance, and you'll keep supporting yourself. So basically, if you want to be over 12 METs of activity, of fitness, and you're going to lose fitness as you get older in life. So really work hard at preserving that and developing that. And so I think that's really important. So pick the right people around you. And I think you did a good job. And then your tips about aging well. I think go to the next slide. I think about our living arrangements. Tell us about your house here.
Well, we've moved from a 3-floor house, the basement and 2 other floors, with 5 bedrooms. We've moved to a condominium, and the condominium has living room, dining room, bathroom, and bedroom all on 1 floor, including the laundry. And that was a decision, and it was basically an even Steven trade. We sold the house and bought this place for about the same amount of money, and that's allowed us to be happy in a space where we no longer are. The house is no longer an impediment to our ability to live, and part of that is the house itself, and part of it is what's in the house. And my father was an interior decorator, it turns out. So we decorated the interior of the place. Greg has been here, so that you can easily negotiate getting anywhere in the house. And one of those things is my wife is 5'3". Now, climbing onto a bed is not something that she can do easily. So I bought a bed that is only 1.5 feet from the floor. The distance between her foot and her knee. So she can sit on the edge of the bed without having to climb up or climb down, which means she doesn't fall off the bed or have to climb into it. And simple little things like that are things that we've done to make the place work for us. And again, these are things that you have to think a little bit, you have to plan a little bit, and you have to make it happen. But we've made it happen. And I can turn all the lights in the house on and off from my phone. Another trick that Dr. Curnew and I learned at the Apple place. So things like that also help us to function. Finally, the kitchen stove is a hazard. It's a hazard because it gets hot. It's a hazard because my wife can't move as well as she needs to. And getting off of if she was to touch something and burn herself, she wouldn't be able to move away from it. So I bought, instead of the stove that we had, I bought an induction stove. And again, you turn that thing on, put your hand on the element, there's no heat. So it's an amazing, safe way to cook. And just as a sort of an idea of something you can try.
So it's kind of important to successful people who stay in their homes longer have how many stairs there are to overcome, how close you are to grocery stores, to
1 minute.
family.
1 minute away.
And so there's different communities to think about. Being on one floor is very important as we get older in life. So what I'm encouraging everybody to do is, like, we do the CN Tower climbs every year. So I want you to do your own, or is do stairs as part of your training to keep fit, because that's we lose those thigh muscles as we get older in life. So keep that well trained. And I've seen some very many people not be able to go home or look after themselves because they fall. You can get a physiotherapist, an occupational therapist to come assess, from rugs, what to do, in the bathroom. And the government will give you some help, but it's quite limited, and you really need to do a lot on your own. And I like this idea of having the type of stove that you have, and also living on one floor is important. Next slide, please. Now, transportation, talk about that a little bit, and also too about, I'm not sure if we're going to talk about is when it's safe to travel and not to travel, and how you approach that at this stage.
You're asking me that question?
Yeah.
As I'm getting older, I'm less and less likely to drive at night. As I get older, I'm happier to have a car that helps me to drive. As I get older, I need to be able to get in and out of the car a little bit with less difficulty. We used to have a Mazda Miata. That was my little wedding present to Evie when we got married, was a Mazda Miata, which she loved. But at a point in time, all of a sudden, we can't get in and out of it. So actually, the car that we have is easy for me to get Evie in and out of, and for me to get in and out of. Now, I haven't had to do that since the COVID, but so we'll see how that goes, and may have to change my thoughts on that if we need a different kind of vehicle. But at the moment, the car that we have is perfect.
Now,
And
one of the things too,
by the way, it's easy to maintain. There's no maintenance except change the tires.
One thing is that devices, canes or walkers and things that nature, is that if you need a walker, get a walker. For some of us, because if you're walking, you get tired, you can sit down on the walker.
Yes.
And so they keep you more mobile. But I think this idea about an apple a day keeps the doctor away is important. But using the proper devices. Tell us about traveling, and how much traveling you've done. Will you travel now? And when it's time for people to say, I'm not going to travel, and insurance issues as well. What's your thoughts on that?
We've shrunk the distances that we're willing to travel. We did go on a cruise this summer in Ontario on a boat from Big Chute to Peterborough through Little Lakes, and it was wonderful. We never had to leave the boat, and they took excellent care of us. We could just sit and watch everything go by if we wanted. So that's our pleasure, and our traveling is influenced by one of the slides that's coming up. The thing that I've realized with my wife is happiness for her is seeing face to face her children and her grandchildren. So once a week, we drive to one of the three children's homes. There's a child in Grimsby, a child in Burlington, and a child in Newmarket. And we, instead of having them come here, we've been going there. And the reason is simple. If we go to visit a grandchild or child, when we're done, we can just get in the car and come home. And so it ends. If they come here, it doesn't end. When we get tired, they aren't ready to go. And so it's my opinion, even though we had them here at Thanksgiving, my opinion is very successful going to visit and leaving when we're finished, when we've had enough. We do it during the day, we do it during the weekend, and we do it in the car that drives itself. So I hold the steering wheel and say, go there, and it goes there, including all the stops and all the stoplights. And man, well, how nice that is. So that's what's happened to us. Our distances have shrunk. In terms of insurance, I'm a dual citizen, US and Canadian. I have Social Security as well as Medicare. And so I'm insured if I go to the States. I have 2 children who live in the States and I can go and see them. But even that has changed. I haven't been to see the children for years. They've come here to see us, but we haven't been to see them. I went to medical school in Rochester, New York, and we had our delayed 50th reunion after COVID ended, which was this past year. And I did go to Rochester for that for 4 days, and enjoyed that a lot.
I think one of the things to realize that many of us want to travel as we get older. And what I've learned is after the age of 71, most people travel goes down dramatically because they get illness, they get sick,
Mhm.
and they can't travel. Cost of insurance becomes an issue.
Mhm.
And so one of the things to think is if you want to travel while you're still healthy enough. And then
Yes.
at some point in time, you're going to lose that. And one of the things is that I'm 64 right now, and I'm really going to try to spend the next few years, still working away. But I want to spend more time traveling with my wife, and seeing my kids and things. When my kids were quite young, we used to go to conferences together. She used to track them everywhere, and I'm grateful for that because I go to the conference and then we do activities in the evening time. And now they're scattered. My son now lives in New York, so I'm really looking forward to going to a conference called Valentine Fuster in December and spending some time with him. Just went to Thailand with my wife. Went to this yoga exercise retreat. It was wonderful. There's this ski meeting that we go Lake Louise or Whistler, sorry, in January. I'm looking forward to that, and I want to take some more time. So, but I realize that at some point in time, I'm going to lose that ability. And so just sort of think about how that's going to fit in and do the things before you lose that, and make steps so you can actually push that, delay that. Is that I'm still reasonably fit, not as fit as I want to. If I compare myself to my patients, I'm a superstar. But if I compare to my friends at the gym, I'm at the bottom of the list. So I got to keep working and struggling to get there. I hope you guys think there as well. So next slide. And traveling can be a problem. Don't lie to insurance companies because that they'll find out. They'll pull records and things of that nature as well. So and filling out those forms is a nightmare. It's like it's a legal document, so to speak. And so spend the time to find that out. Have you looked at any extra insurance for travels outside of the States for yourself, for your wife, or different parts of the world? What's your thought?
She's a retired teacher, and they have absolutely outstanding travel insurance as a retired teacher, and it's not extraordinarily expensive. But independent of that, we've cut down our travel. Absolutely cut down our travel. We're both I'm 84 and she's 83, and so I think we've been to all the places we wanted to go. And when she was younger and her son was in teachers college in Australia, she went to Australia. And so we've done that. We've been there, done that, got the t-shirt, and we're now enjoying different things. I don't look at it, Greg, I don't look at it as a loss. I look at it as an adventure. The adventure is changing. And The fact that it doesn't go as far is just part of the adventure. It's not a loss. You know, it's a new horizon, and that horizon is becoming magical. I give you an example. We go for a ride in the car to Turkey Point and back. It's 20 minutes. She gets in the car and we're on a back road, and she's seeing trees that she's never seen before, that she's never noticed. She's seeing clouds, she's seeing sky, she's seeing sunsets, and they're absolutely mesmerizing for her and for me. So what's happened is our view is different, but it's not less. In fact, it's every bit as magical as the others. It's just a different magic.
That's one of the things I love about you, John. You see the best in everybody in the world, and you make those around you better. If we all practice what you did, the world would be a much better place. And you make this world a better place, and so is your lovely wife. And I think we need to be attentive to the environment, to others, and to be grateful. And thank you for sharing that. I mentioned about illumination. One of the things is as I get older, I get colder. I need more heat. My wife says she's getting warmer. I'm getting colder. Most of us get after she went through the menopause a number of years ago. She's never got over all the hot flushes, and I need more light now. You mentioned, nighttime driving. Many of us will develop cataracts and eye problems as we age. Tell us about illumination, how it means to you.
Well, for me, I've got there's only LEDs in the house, and they can be I can change their color and their hue and whatever else I can do with them. But basically, I like it to be bright white and where I can read easily. So that's what I've done, and I've got them all on my phone, so I can pick up my phone and turn them all off. And again, that's saved me having to get up and run around and turn them all off. But it also means that as a safety thing, if we have to get up in the middle of the night, I can flick them all on without just getting off my pillow. So that's again another thing that makes it safer and more interesting. And learning how to do that is exercising my head. So it's win-win-win. I just look at it and say, wow, what a wonderful thing. So
getting up at nighttime for us guys, going to the bathroom quite a bit and making it safe, knowing the pathway you're going to take. And when you get out of bed, sit on the side of the bed for a little bit, let your body readjust and have good lighting. I've seen so many people slip and fall. And one of the things is that they got up too quickly, or number two is they tripped over something. They didn't have the lights on. So I think that's important.
Well, one of the things I did, I bought a remote vacuum, and the remote vacuum requires that there not be a lot of obstructions. So again, by getting the vacuum, I had to find ways to get rid of stuff so that the vacuum could do its thing. So it's interesting how little changes perpetuate other changes, which perpetuate other changes, which perpetuate your mind to think. So that's happened here.
I'm a hoarder, so I have to be careful about that. And,
yeah, I'm trying to get rid of stuff now. You can come over here and hoard any of my stuff that you want.
My wife would like you to come over and take half my house, all my stuff away.
You just need a bigger barn.
If you notice my office, I have piles everywhere, so don't put them on the floor.
Yeah.
Next slide, please. Thank you. Tell us about communication.
Well, again, with my wife, the joys come from her kids and her grandchildren. And when her son went off to Australia to teachers college, I went to the Apple store, bought a computer that had a camera and gave it to him to take with him. And then I went back and bought a second one for us. So we were able to keep in touch with him all the time. Now, the reason family is so important to her is complicated. One reason is her mother and dad both died, and her oldest sister discovered breast cancer at her wedding day and died shortly after that. So lost her mom and dad, lost her sister, and then married, and her husband didn't take care of himself, had a stroke and died, and left her at age 40 with 3 little kids. So keeping in touch with the remainder of her family, a huge important thing, for which thank God for Apple, thank God for IBM, thank God for Microsoft, that we can do FaceTime or Zoom or what have you and keep in touch with the people that we love. It's made a huge difference to us. And in addition to that, Evie was diagnosed at my medical school with her Parkinsonism, and we were able to continue relationships with our doctor there over the internet using Zoom or something equivalent to Zoom, which was again a wonderful asset. And I think I'm keen for you to do that too, Greg.
Yeah, so one of the things that we have is a medical software called Medjo. It's a clinical grade Zoom, but even a little bit better than that. And
Yes.
and we find that a lot of the patients don't want to do that. So the government allows us to see people in person by a medicalized Zoom-like platform called Medjos or phone calls. And trying to encourage more of us to use that Medjo platform. And we have videos on that. We have videos on how to use Zoom, FaceTime, use them. Good way of keeping in touch. Next slide, please. And you can put all those things here. And so talking about chronic illness a little bit over here. As we get older, it's at the age of 60 years of age, most of us have 1 or 2 chronic medical problems, from heart disease, diabetes, lung disease, neurological problems, falls, Parkinson's, Alzheimer's, dementia. It goes on and chronic renal insufficiency. So how do you find that you especially with your wife who has quite advanced Parkinson's being an issue, how do you find that's doing? Because I think your heart disease, you slowed down, but you're still participating. Your heart's getting good blood supply. We use the stress test. Your med output, your weight's down, your blood pressure's down, your cholesterol's down. Your cholesterol's quite good. Your lungs are good. Maybe a little bit slower, but you're still doing quite well. But your wife's struggling more with her Parkinson's, and how do you find that?
Well, there's a tendency for you to feel sad or sorry for yourself or depressed, or there's a tendency for that. And there's a necessity for that to occur. And the 2 things that I would say about it are, it's important that you allow yourself and your spouse to be sad and to cry and to be sorry that they have something that's not going to get better. On the other hand, it's also important, I think, that you look for and find things that are joyful in your day, for which at the end of the day, you can start grinning and smiling. And so what I've told my wife is, I'm okay with having these things that are impacting us both. My arthritis, my lack of mental ability, my heart limits. It's okay to have that and to feel sorry that I'm not the person I was 20 years ago. But it's also good to learn how to live with that and to find ways to experience joy. And I'm not sure that I can tell you any numbers, but people who can find those ways to be in their life will have not only a more enjoyable life, but they will also, I think, live longer and be happier longer. You know, the end is coming soon enough for us all. But the getting there, I think, why not? Why not smile? And
You know, there's different phases of retirement. When most people initially retire, the first phase is I want to do nothing. I just want to, spend some more time exercising. I just want to relax more. That phase lasts usually less than 2 years for most people, and they get bored. What's next to do, so finding a new life in retirement. And one way that many people find joy is either starting a new hobbies or new hobbies, and also volunteering their time and doing your music, and you've done all the choirs, and you sang, and your group sang at our health picnics in the past, and maybe we'll get back to that at some point in time. And so please find a way to learn new activities and hobbies. And for many people, is finding volunteer work can be very rewarding. So something to think about. Next slide, please.
What I did, I went to the reserve, and on the reserve there was an Apple store, and that's where I bought the computers that I gave to my son and to my wife. And I volunteered out there. I said, I told them what you need. There's a lot of old people coming in to buy computers here, and you're not going about it right. What you need to do is to show them how to use the machine, not just to sell them the machine. And if you show them how to use it, they'll get some excitement and get some joy out of it when they get it home, if they buy it. I need to back up. My father worked for Simpson's in Toronto. It was a retail store, and he sold furniture. I got a job there one summer selling luggage, women's luggage. At the end of the summer, I was evaluated. There were 4 of us working in the department, 3 salesmen and myself. I outsold all the other guys by $100 a day. Now, in 1950 something, that was a lot of money. I outsold them by that much because I listened to them and said, what do you need? I didn't try to sell them something that they couldn't use and didn't need. So my sales were higher, my returns were lower. When I went to the reserve, I sat down with people who'd come into the store, and I'd sit down with them and I'd help them. What do you want to do with this anyway? And I'd teach them how to use it. And the next thing you know, they'd go home happy customers. And they did not necessarily buying anything then. Maybe they come back next week. But yeah. So my experience with living with what I can't do was that I started doing this as a volunteer to help people learn how to use the machines who were older, and it was much more difficult for us to learn at an old age. So it was great fun for me, and great fun for them too.
And thank you for all your teaching in computers. I'm still learning and forgetting and relearning. Next slide, please. Thank you. So we talked about this already, so I don't know.
So go by this. Go by this.
Yeah, we'll go ahead. So pick a place where you can live, where you want to, so one of the things is that a lot of people talk about is that where you want to retire, do you want to be close to family, hobbies, friends, do you want to travel, but live in a place that you can do all the things you want to, and usually it's one floor. I've seen some people that have decided that there's one gentleman hasn't done this yet, but he's on a 2-floor house, but he actually put in when his house was redesigned, an elevator shaft. So if he does require it, he can put an elevator into his house in the future if he wanted to. Not saying he's going to, but I think that was that's quite a bit of planning. Next slide, please. Yeah, so work-life balance. I think I'm probably the wrong guy to talk about this. So how do you find that balance between work and life? And how do you find that? And how do you find that now as one gets a little bit older? And when you have disease and things of that nature, how does that put into the equation?
Well, the necessities you do. I mean, you've got to do them. You've got to shop. You've got to, you've got to eat. you need clothes. So that's pretty simple. In terms of balancing what we want to do and what we can do, I told you how we've been doing that up till now. We just make a decision. Oh, I give you an example. Middle of the night, my wife wakes up and says, geez, I can't sleep. I said, okay, let's go for a drive. So we got in the car, went to the Lake Erie, and watched the sun come up. Now, I don't know how many of you have watched the sun come up over Lake Erie, but we have at our age. And we were the only people there. We were at the dock. There's nobody there, just us. Oh, amazing. Just amazing. So anyway, we just make decisions that are things that we can do and try to find some way to laugh at each other and laugh at the world. So laugh with the world. Yeah.
So what would you tell people that that become widowed and don't seem to have, are lonely and things of nature? How would people reach out to establish relationships?
I haven't worked that out. I would say to you, in all honesty, what's going to happen to the other one of us when one of us dies? I haven't got that worked out. My feeling now is, and it's just a feeling, maybe it's selfish, if she's gone, I don't want to be here. That sort of feeling. And I just want to be wherever she is. That's my thought. But I haven't worked out what's going to happen if she goes first. And I don't think she's worked out what's going to happen if I go first. So I don't have an answer for that. Do you?
I think just having lots of different friendships. So one of the secrets to longevity is quality relationships. So having other family, friends, hobbies, and groups. So if you like singing, for instance, so you'll probably spend more time with your choir buddies and things of nature. If you're a churchgoer, you spend more time with your congregation. If you're a flyer like me in the future, I'll spend my time at my flying club, and maybe I'll be good enough one day to teach somebody else how to fly. Right now, I would not go flying with me because it's not safe. But and just this lifelong learning. I don't want to see people just sit at the, watching 6 hours of TV every day. Is that go experience, if it's like cards, go play cards or something. Just
You know
try
what I
something.
did?
What's that?
I canceled my cable TV. And you know
Good.
what I'm doing now? I'm reading the New England Journal of Medicine instead.
Nice.
Why not?
Nice. Good. I think what's keeping me going is I have all these young people over here that get great joy watching them take over the world, and they make you healthier. They make me healthier. Next slide, please. What's some of the messages that I think you shared so much already? Have we forgotten anything?
Oh, yes, I'd like to tell you something. So I'd like to now you to forget that I'm a physician, and I want you to remember that I used to work in a bank, and I used to keep track of money. So a friend of my son, Matthew, came to see us when he was 14, and he said, look, Mr. Deacon, Dr. Deacon, look what I just bought. I've got a new fishing pole and tackle and whatever, $1,000. I said, gee, interesting. Do you know what you just gave away? And the answer was he did not. But listen, can you subtract 10 from 65? So let's say he bought something at age 10, a new bike or something like that. 65. You've now got 55. I want you to take that $1,000 he spent, and I want you to tell me how much money do you think that is at 65? Do you have any idea? What did he give away? What did he give away? He bought $1,000. What did he give away at 65? The answer is every 7 years, at the current rate of growth of money, your money doubles. How many times does 7 go into 55? Come on, somebody knows. Somebody must answer. Huh? How many times?
I think you're
7
making an
sevens
assumption
are
that
49, 8. 8. Okay, 1,000. 1,000. Watch this. 2,000, 4,000, 8,000, 16,000, 32,000, 64,000, 128,000 at 7 times. He gave away at 65 $128,000. So, simple message to you is, I know you've all got debts. Simple message to you is, save a little, save it every week, save it, and don't spend it. Please, do it now. Start soon. And you will be just so surprised at what you have that you might like to spend it on when you're 65 or before. But yeah, the power of compound interest, it's so simple, my gosh. But you should plan. You should plan to be thrifty. That's a little message. And the other message I said was, put your hand on the shoulder of there's something quite special about when I come in to see Dr. Curnew and he puts his hand on my shoulder and says, how are you? And he does the same to Mrs. Deacon. There's something about touch. There's something about looking somebody straight in the eye and saying, how are you? How are you doing? Big deal. Don't give that away. You can do all the other stuff that Dr. Curnew has you do, but please do that for me.
it's kind of interesting. I come from a Hungarian background, and we used to hug and kiss a lot, and you can't do that anymore.
No, but you can put your hand on the shoulder, or
I like this new handshake. It makes me feel. I look forward to the days we can get hugging again. But for now, this little
that's okay.
elbow handshake makes me feel good. So,
but the hand on the shoulder that you do every single time is not something that isn't noticed by me, and it means the world.
One of the things right now, we live in a world we have to watch. These mass distancing and filtering and things of that nature as well. And we have to be attentive to that, but we still need the other aspects as well. One of the struggles I have these computers to deal with and looking at information and try to deal with you. And I want you to come look at the computer screen too as well, so we can share the information together, and we'll find our new ways of making contact. Thank you. Next slide, please. Yeah, learning never stops. I think, to me, is that I'm curious, and you're curious, and I hope we're all curious. I don't know what more to say. Is that don't let that stop. And if you're not sure what to be curious about, try different things. Search.
The way learning only occurs when you're wrong about things. So it's very important in the learning process that you do not know the answer to any of the questions that I ask you. Very important, because it's only when you don't know the answer or you have the wrong answer that you learn. So it's okay to be wrong.
Next slide, please. I like that.
It's okay to make
this to me is a key message. I miss my dad, but one of the things is that I said, Greg, most of us worry about failure. We're afraid to try because we're afraid of failures. Fail big, and don't be afraid to make mistakes. What's your thoughts about that? I think this is so key. If you're not making mistakes, you're not learning something.
Yes. I have nothing to add. I love it.
Make mistakes, and don't let it define you. Just, it's a process. You're learning to play a new instrument. I'm learning to fly a plane glider, and at some point in time, will I ever learn how to fly this plane? I don't know.
Doesn't matter.
I'm enjoying the process and learning the people around me are wonderful teachers. And I appreciate their kindness. Next slide, please. And learn about videos. Yeah, believe in yourself. And you know, I think Churchill said it best. Success is the ability to go to one failure to the next with no loss of enthusiasm.
Mhm.
Now he said other things that people may not be appreciative of, but that's something that was a very powerful statement. I don't know if you will all the time, but if you just try to enjoy the journey more, I think that's the key. What's your thoughts about that?
Well, yeah, I think if you'd have told me when I was 21 that I was going to become a physician and be in the top of my class at U of T, I'd have laughed at you. But so I think Mrs. Deacon Evie thought I could, told me I could, and all of a sudden I could. So I think a lot of it has to do with the will to try, the will to fail, the will to get back up again and keep going. I think a lot of it has to do with that. There's certainly physical things that we can't do, but and trying isn't going to make it any better. But a lot of what we can do will happen because you will it to happen. I think on the other side of that fence, I said this in one of my little notes, wanting what you have instead of having what you want is another big thing for me. If you realize, here's what I have a wife with Parkinsonism. She can't walk, she can't stand yet because of the COVID, and it's coming back. It's coming back gradually, but very slowly. So I'm happy I have what she has. I'm wanting what I have rather than having what I want, because I can never. Yeah, that's a little phrase that I just love. Yeah, I mentioned the touch thing. My wife loves orchids. There are 2 orchids waiting for her to come home, 2 new ones
Nice.
in the front. Nothing quite like a flower. My gosh.
Yeah. So this brings us to the end of the webinar, and I just wanted to give a really, really big thanks for Dr. Deacon for joining us tonight and sharing all of that wonderful information and all those lessons, and also for Dr. Curnew for adding to it as well, and just having all of our healths in mind. Any last comments or thoughts before we end things off?
John, what's your final summary or thoughts?
Keep smiling. Keep smiling. Yes. I wish, and things that I wish I was still doing. I wish I was in Dr. Curnew's shoes for a day to enjoy all the things he gets out of you guys. Because I know he's getting more from you than you're getting from him. So I wish I was there to enjoy all of the good things that you guys give to his office and to his practice and to his person, because it's what makes him him.
I think I have a very special practice because all these young minds have made this clinic a really good place to be. And if you're in a hurry, I'm the wrong guy for you. If you have a problem, we'll fit you in somehow and make things work, because people, are sometimes worried about their blood pressure from being too high, too low, chest pain, their breathing problems, and want to be available to fit people in when they need it the most. And that's something very important to me. So time is less relevant. I understand for some people it's the exact opposite. Is your time's valuable. I'm not saying that, but I want to be able to pivot when I think the most important thing. I think I quote Spock in Star Trek. Sometimes the needs of one outleads the needs of many, and sometimes the needs of many outweigh the needs of one. And so I was a Star Trek freak all my life, and this exploration I explore helps, and want to share that with you. I want to thank everybody for putting this together. You guys did a wonderful job. Amir, final thoughts.
It was really great to hear both, Dr. Deacon and your thoughts as well. I think there are quite a few take-home messages tonight. You know, being caring, sort of taking the time to enjoy life, and sort of accommodating your lifestyle for how your life changes, and accommodating the things around you for that. And it was really great hearing all that, and I'm sure everyone will benefit from Dr. Deacon and your information shared here tonight.
Well, I want to thank Kathy and Yasmin for putting all this together. And I see Sedentinger is there joining us like usual, and he has lots of words of wisdom. Do you have any final words of wisdom?
Oh, what can I tell you? I attend every webinar of yours, and the reason being, like Dr. Deacon said, like you said, you cannot learn much. You always learn every day. So I learned everything that Dr. Deacon said. It's wonderful. What I'm shocked at, I mentioned that to you before, in this webinar, there are only two patients, Dr. Deacon and myself. And I cannot believe all the good work you do, and your patients don't attend the webinar. All they can do is learn. It's free on top of it. So I just can't, it just boggles my mind. So thank you. I learned a lot, Dr. Deacon. I practice what you were mentioning. Try to, my diet is very bad. I'm working on it, but that's the only, we all have pains and joint pains and can only do so much exercise. But otherwise, it was wonderful. And I'll see you on the next webinar.
Well, thank you very much for your kind words. To me, is that I'm a work in progress, always trying to get better and healthier. And John, you make it easier to do that. And I think if we all tried to make this world a little bit better, life would be a better place for all of us. And thank you for sharing your stories. From a guy that wasn't going to live for too long. How many years since your bypass again?
1986, and this is quite a few years past that.
So when I first started practice, if you got 10 years after a bypass, that was a good thing. Now we can do a lot more, and deciding who should have a bypass and when, or when to have a valve surgery, how to treat congestive heart failure. And I think you did it well by getting your body mass index probably over 35, in the high 30s or the mid 30s to in the low 20s is an accomplishment.
Greg, it's 37 years for me.
Yeah.
Yeah, but it's not only the bypass; it's the lifestyle changes that he made.
Yes.
Bypass is okay, but the
Yes.
lifestyle changes that Dr. Curnew, you always preach,
Yes.
and most of us don't listen. We don't do it.
I think everybody tries a little, and if you add all the littles up, it's a lot. Everybody tries.
Well, listen, I'm going to thank the whole team. Special thanks to Katie and Yasmin for putting this together. And I bid everybody good night. I still have a few phone calls to make. What else is new? And thank you all for attending, and great night, everybody. And take a look.
Good night.
Good one.
Thanks, John.
You're welcome.
Give my love to your wife.
I will.